Recording is started now. I'll share my screen. Okay. So today we have to start the unit 2, which is supporting individual in adult social care, and we have to discuss about the learning outcome. Right. Mute your mic and then I'll start my lecture. Right. So, okay, we have to start the lecture on the unit 2, which is supporting learning individuals in adult social care need, adult and social care. And the learning outcome 1 is understand communication in adult social care. Right. So if we talk about the specific learning outcome and the unit specification, so what it has, effective communication is essential in adult and social care to ensure that individuals receive the support they need and to build trust and rapport with them. So it is essential in health and social care, and even we cannot say that it's only like effective or it's only required in health and social care field. Again, as I say that whatever ethical values, whatever social values, whatever we learn about training, respect, dignity, confidentiality, or any other aspect, whatever we have learned in our course, it applies to all the aspects of life and all the aspects of business related activities, whether it's health or social care or with any other business related. So, but as we are studying specifically the health and social care context, so in that, for example, we have different kinds of communication. We have verbal communication. So, what does verbal communication involve? So, verbal communication involves speaking and listening. It has both sides. It is important to use clear and simple language when communicating with adults in social care setting. Just for example, instead of using a jargon or complex terms, a care worker might say, um, would you like some help with your meal? Or by this, this clear and direct question, what it does, it encourages open communication and shows respect for the individual's autonomy. So we always use simple language. We will try to use simple language. Then, for example, uh, we will have non-verbal communication as well. So, non-verbal communication includes body language, facial expression, and gestures. Maintaining eye contact, nodding in acknowledgement, and using a friendly tone of voice all are examples of positive non-verbal communication. And again, for example, a care worker sitting at eye level with a resident and smiling warmly can convey empathy and understanding without saying a word. So, what we always do, again, in general life, we always try to be empathic and then we try to smile. So, this is the same we'll do with our service users. Then we have written communication as well. So, written communication is important for documenting important information. What it could include, for example, a care plan, medication schedule, and sometimes we make the progress notes. Clear and accurate documentation ensures that all care staff are informed about the individual needs and preferences. Again, for example, a care worker might write detailed notes about a resident's daily activities, any health concern, or changes in behavior to ensure continuity of care. Then we have active listening as well in communication. So, active listening is again very important. Active listening involves giving full attention to the speaker and demonstrating empathy and understanding. Care workers can practice active listening by paraphrasing the individual words, asking clarifying questions, and providing feedback. Uh, for example, um, a care worker might say, "It sounds like you are feeling anxious and about the upcoming appointment. Is there anything specific that is worrying you?" So we may ask some sort of questions, and the service user would um be able to answer us, and then it would be helpful for both the service user and the care worker. Then, for example, we would say empathy and respect again is important. So, showing empathy and respect towards individual in adult social care is key to building positive relationships. Care workers can demonstrate empathy by acknowledging the individual's feelings and showing understanding. For example, a care worker might say, "I can see that you are feeling frustrated. Let's work together to find a solution that works for you." So by asking these sort of questions and showing empathy, what we are doing is we are making a good relationship with the service user, and it could help both the um, service user and the care worker as well. So now we'll go to the next slide. So in the next slide, we have to discuss about the aims of the unit, right? So if we discuss about the aims of this unit, so understanding the practical aspects of adult social care and how they contribute to the health and well-being of service user is essential for every a care provider in this field. And what it could include, just for example, personal care task, and personal care task involve assisting individuals with activities of daily living such as bathing, dressing, grooming, and toileting. And we may learn proper techniques for assisting with these tasks in a uh, respectful manner. Uh, for example, uh, we may practice using a hoist to transfer a resident from a bed to a wheelchair safety, ensuring both the in-house resident comfort and the caregiver safety as well. So we always get the training for that. And for example, communication techniques. Uh, Again, effective communication skills are vital in adult care to build relationship with service user and understand their needs. Uh, we may practice using different communication techniques, which we discussed earlier, again, such as we discuss about the active listening. For example, we may use questioning, and non-verbal cues is important. For example, uh, we can practice at it depends upon the care home or the service provider employer, that sometime like we go to the trainings and we do the role plays as well. So by that we will learn the empathy and how to respond a resident. So we have different means like we can use, and we can be a good service provider for a service user. Right, and then we can say that we will have medication management as well in that. So it is like very important for us to understand how to safely administer medication, and is crucial in health and social care. And as a student or as a care worker or health or social care worker, what we can do is we may study medication type, dosage, uh, its protocols, and the importance of accurate record keeping. So, as we are not qualified to prescribe any medication, but we have to administer the medication, so we need to be familiar with these kind of uh, procedures as well. Then, as I was talking about the procedures, so in procedures, safeguarding is also very important. So what we can do is we learn and we will be taught how to identify and respond to signs of abuse, neglect, or exploitation in adult social care setting. And we may learn about safeguarding policies and procedures, reporting requirements, and the importance of maintaining confidentiality. This is again really very important. Safeguarding procedures we discussed in our previous lectures as well, in the previous unit as well, that safeguarding is very important, whistleblowing. So we should all be aware of these policies and principles. And every organization has its own um, organization policies as well. We have the national policies, we have the local policies, we have the internal policies as well. So we need to consider all of those. Uh, and in the meanwhile, if you have any question, please don't hesitate to ask me the questions. And then we can say about the person-centered care approaches as well. Person-centered care approaches is important in this unit as well again. So person-centered care focuses on the individual preferences, needs, and choices. We have discussed these in detail in previous units as well. So whatever we do is based on the person-centered care approach of the service user. So this is about this side. Then we have learning outcome one, indicative content. Okay, so we have few bullet points here. So these are methods of effective communication and when to use different methods, importance of communication. Okay, so we are going to explore the various methods of communication within the context of health and social care. And again, effective communication is crucial in healthcare setting. Why? Because it ensures accurate information sharing between healthcare providers and service users for better care outcomes. So there are several methods of communication which we discussed earlier as well. For example, verbal, non-verbal, written, or electronic communication as well. So, for example, where can we use a non-verbal communication in a healthcare setting? So just for example, non-verbal communication could be used when a service user is non-responsive verbally, but can nod or shake their head to respond. So we might have used these non-verbal uh, techniques as well in our work placement or the place where we are working, or even like in terms of safeguarding, we need to look for the non-verbal cues as well. And uh, non-verbal cues are indeed vital in assessing a patient or the service user state. And so reasons for communication in this sector is are like example, apart from exchanging information, and there are some other reasons we communicate in health and social care. For example, without communication, we cannot build trust and understanding between service user and caregivers. And building a relationship of trust is fundamental in health and social care. And communication faces several barriers as well. So now asking about the barriers. Okay. So for example, we have barriers like, for example, a language barrier can be a barrier in communication. And how can we overcome by using uh, like this issue? We can use translators or visual aids as well, um, in order to overcome this barrier. And language barriers are common, and overcoming them is essential for effective communication. We always need to have a translator or interpreter. We may use them, and we can use visual aids as well. And we may use, like, if the service user can write or read English, so we can write questions and they can write the answer on the paper as well, something like that. And for example, if we what would be the impact of failed communication in health and social care, and why it is so significant? So because we have to discuss about the impact of poor communication. So it is like service user or an organization, and it could lead to poor decision making, risks such as wrong medication treatment, poor relationship, and upset service user, low moral, etc. They have written there. So again, mm, like for example, uh, we have discussed about the incorrect treatments and even harm to the service user as well. So it is very important that um, we will use the communication channels properly. Then we have the next slide. Okay. Again, it is continuation of the previous slide, and using positive communication skills, active listening. Right, okay. So uh, now again, we will have to discuss about some specific aspects and tools of communication, which are used especially in health and social care. And like, what are some positive communication skills that healthcare provider can use to enhance a service user interaction? So again, in that, we could have active listening, clear speaking, empathy, and maintaining eye contact. And active listening and empathy particularly ensure that the service user uh, is able to express their feelings, and we are able to understand them, and we will try our best to help them. And right, then we have to discuss about the assistive technology. Okay, so now what is assistive technology? For example, we have example of telephone relay system, voice recognition software, apps, and social media, text-to-speech software. So we have a lot of examples here. So for example, why we use these technologies. So for example, hearing aids we use, and what they do is it improve the auditory input for those with hearing impairments. And uh, these technologies play a crucial role in facilitating communication where natural abilities might be limited. And for example, we discuss about the hearing aids, or they have given us some more examples about the uh, audio transcribers, audiobooks, and Braille. For example, if someone is partially blind or they cannot like read it, so they some service user may use Braille as well. So now we will discuss about the um, interpreters. Okay, so what interpreters do, they help bridge the language gap between service user and healthcare providers, ensuring that accurate and full communication occurs despite language differences. And for example, now we have visual communication, right? So in visual communication as well, we have sign language, use of pictures, signs of symbols such as picture exchange communication, right? So we have so many options here. For example, they have given the example of PECS, and what it does, it uses um, pictures to help individuals communicate without speech by handing over pictures for everyday needs and feelings. Visual aids like PECS are invaluable, and especially in situations where verbal communication is not possible. And then what we have, advocacy, right? Okay, so this is again very important in dealing with the vulnerable service users. So what would be the like concept of advocacy in communication within health and social care? So we can say that advocacy in communication means speaking up for service users who may be unable to express their needs or rights, ensuring they receive appropriate care and service user. So as advocates, what they do is advocates play a critical role, especially in supporting those who are vulnerable. And uh, what we have next is communication skills, speak and listen, body language, written communication. Okay, so as we discussed earlier, that we have to learn some communication skills, and which includes speaking and listening, body language, written communication. So we should learn all these skills, and that could help us. And when we learn the art of speaking and listening, and we learn about the body language signs for any uh, when we are doing a risk assessment for a service user, then we may use, or we may look for the body language of the service user as well. So we need to learn these skills. And then we have principles of effective communication, right? So whenever we will talk about the principles of uh, effective communication, so what we will say about it, that clarity and empathy, respect, all are important principles of effective communication. So we should always be empathic towards the service user, and we should respect them. So these are some of the important points. Again, few examples are also clear, concise, meets audience needs or the service user needs. Moving on to the next slide. Again, it is the continuation of the previous slide. So, uh, effectiveness of communication, asking questions, PECS again. Right, okay. So we will focus on the evaluation and regulatory side of communication in health and social care, including the importance of record keeping and the use of ICT. So how can healthcare professionals check the effectiveness of their communication with service user? So by receiving feedback, observing patient or the service user responses, and evaluating patient or the service user outcomes to see if the information was understood and acted upon correctly. So feedback is a key indicator of whether the communication was effective. And for example, what might prompt a healthcare professional to adjust their communication method with a service user. Uh, as an example, if the service user seems confused or distressed, or if there are misunderstanding, and adjustment may be necessary to ensure clarity and understanding. And this is important with that. Then confidentiality, importance of confidentiality and risk to confidentiality. Okay. So again, we have discussed that previously in our previous units as well. So this is very important. What it does, like when we talk about the confidentiality and why it is important to maintain confidentiality in health and social care, what it does, it protects service user privacy, build trust, and complies with legal standards. So closely linked to confidentiality is the concept of consent. So consent is also important. Uh, Whenever we deal with a service user, uh, we use the consent in health and social care setting as well. What it does, it ensures that the service user agrees to the care provided and understand what it has and respecting their rights as well. So respecting a service user is very fundamental in health and social care. And then we can discuss about the basic requirements for keeping records in health and social care. So again, this is very important, keeping record. Records should be accurate, up to date, factual, and stored securely to protect a service user confidentiality. So it's linked with the confidentiality element as well, regarding the record keeping as well. So they have given us some examples, like the care plans, medicines administration record, and why record keeping again is important. So it ensures that continuity of care, provides legal documentation of the care provided, and aids in clinical decision making as well. It also helps if we consider the potential consequences of not complying with these practices. So what might be the consequences? For example, if we don't uh, oblige with the legal requirements, then what could happen? Legal action against us, loss of trust from service user, and potentially harmful mistakes in service user care. And uh, we can now talk about the use of records and reports. How do these tools assist healthcare professionals daily? What they do is they guide clinical decisions, track service user progress, and facilitate communication among care team members. And what record keeping ensures is everyone on the team is informed, and which greatly enhances a service user care. So, what uh, involves in best practice in reporting and recording? Okay. So this is important as well. So best practices include being impartial, timely, clear, and concise in documentation, and right others and organization. Okay. So when we talk about the best practices, so we should be considerate of these bits. Now, for example, uh, ICT, they are telling us about in the next bullet point is the ICT. So ICT systems enable, what they do is they enable faster access to patient record or the service user record, and improve record accuracy through digital templates and securing data storage and sharing among authorized personnel. When we are talking about the multidisciplinary team, so we may use the technology. And these days, like whatever we do is based on the technology. Like the lectures are delivered, the PowerPoint slide, everything what we are doing is digitally. So now moving on to the next slide, we have Right, okay. In that slide, we have to analyze the importance of effective communication and how this can be applied in practice to meet the needs of service user. Right, okay. So we will have to discuss the importance of effective communication in adult social care and explore how it can be practically applied to meet the service user's need. So we can start by analyzing why effective communication is important, and what we can also include into that is uh, and we can discuss about like what effective communication means in the context of adult social care. So effective communication in adult social care means clearly and respectfully exchanging information with the service user to ensure their needs and preferences are understood and met. Effective communication is about more than just exchanging information. It's about doing so in a way that it is respectful, clear, and responsive to the needs of the individual. So, why this is so important in adult social care? So, because without communication, we cannot do anything. And also, like, we can take the feedback, and what it does that it allow us to improve ourselves as well. So feedback again is very crucial. So it involves a two-way interaction, and so we will get the feedbacks as well. Then, for example, uh, what are the uh, I don't know, players of importance of importance of practical application? Okay, so in that we can also discuss about the uh, role of documentation as well. So why it is very effective in communication. So documentation help us to ensure all relevant information is recorded accurately for continuity of care, and it allows different caregivers to be fully informed about the service user needs and preferences. So I believe that these all are the important aspects in analyzing the importance of effective communication, and how we can apply in practice to meet the needs of service user. Now moving on to the next slide, right? So now we have to discuss about the importance of effective communication. Okay, so the first one is facilitating understanding. Okay, so what it does is effective communication ensures that information is conveyed accurately and comprehensively. Right, okay. So discuss about them. So we have building trust and rapport, we have empowerment and involvement. Okay, so in this side we have these three important aspects. So for example, when we talk about the facilitating understanding, so what it does, effective communication, and it is like important in health and social care, um, and by doing so, what it does is it creates understanding between service user and care providers, and this understanding is very crucial in meeting the specific needs and preferences of individuals. Then we have the building trust and rapport. So clear and empathic communication fosters trust and rapport between service user and care providers. Trust is essential for service user to feel comfortable and expressing their needs and concerns, which in turn enable care providers to tailor their support accordingly. Then we have empowerment and involvement. So effective communication empowers service user by involving them in decision-making processes regarding their care by actively listening to their preferences and respecting their choices. Care providers promote self-determination and autonomy as well, by doing so, empowerment and involvement. So these are the 3 points here. Then we have identifying. Okay, it's continuation to the previous slide as well. Identifying and addressing barriers and enhancing quality of care. Right. So now we have to discuss these points here. So now we have to focus on uh, these crucial aspects. Um, for example, if we discuss the various barriers that could hinder across to access to care, and for example, we discussed about the communication barriers earlier. So communication barriers is a barrier in health and social care, and what we will do in that is communication barriers include language differences, cultural mismatches between service user and providers, and physical or cognitive impairments that could affect the communication. So these barriers can significantly impact the service user delivery and impact of service delivery if not properly addressed as a care provider. And how can care providers use communication strategies and technology to help overcome them? So what we can do is care providers can use translation services or language application to overcome language barriers. We discuss about um the interpreter as well, and cultural competence training to address cultural differences. And we can use technology like communication aids, and these are important. And what it will do is employing these tools, it will help us to it will benefit both the service user and the care care provider as well. And in the end, what we will get is a better uh, betterment of the service user. So then we can discuss about the okay, we can discuss about what we have next, technology assisted failures. Right. So we discuss about the language barriers, cultural differences, physical or cognitive impairments, like we discussed about the previously, hearing aids and barriers can be, yes, and by applying these uh, technologies, we can mitigate the barriers, right? So now we have to discuss about the enhancing quality of care. So what it will do is uh, when we will when we'll apply these, we will overcome these barriers, and what it will do is it will enhance the quality of care, and it is central to delivering high quality care that meets unique needs of each individual. So if a service user feedback indicates that a certain treatment is causing discomfort or is not effective, so what a care providers can do is they can adjust medication, or we can use different therapies as well. So it is important, and we'll always try to use the uh, care plans according to the individual service user. And by using these um, individualized care plan, that is very effective, and it would enhance the quality of care. And if we include in the communication bit as well, so that could be very important. And again, it would be helpful for both the service user and the service provider. So now we'll move to the next slide. We have, right, okay, practical application in meeting the needs of service user. So in this one, so we have to discuss about the importance of tailoring communication methods and practices of active listening. So we have two important bits here: tailoring communication method and active listening and empathy. Right. So why it is crucial for a care provider to adopt a communication uh, a better communication method. And what it does is adopting a communication method is essential to ensure that service user can receive and understand information effectively, regardless of their abilities or communication style. It helps in making sure everyone is on the same page. So effective communication means meeting service user needs um, and it would help again in the betterment of the service user. And now, for example, uh, we have to now discuss about different abilities and style. So they are talking about diverse abilities and communication styles, right? So what it could involve is it might include using sign language for individual with hearing impairments, visual aids for those who are visually oriented, or utilizing simplified language for people with cognitive challenges. Tailoring communication in this way ensures that all service users can access and engage with the information they need. So now we have to move on to the active listening. Right. So we discussed about the active listening as well in the previous slides as well. So active listening and empathy allows care providers to truly understand service user feelings and their concerns and their needs. It helps in building trust and rapport, and it enables more personalized care based on the individual unique situation. Active listening and empathy are key components of building a strong relationship based on understanding and trust. Now, what could be the example of active listening? So, for example, if a service user expresses their concern about a new medication, so as I said earlier, then active listening would be important, and what they are feeling, and they may ask some questions, and then we need to clarify those questions, and the service user and the service provider would work together to find a solution, and we can address those concerns effectively. So now, for example, empathy. So how might expressing empathy impact the care provided to service user? So expressing empathy helps service user feel understood, supported, and cared for. It can ease their anxiety, build confidence, and foster a strong therapeutic relationship. And again, what could it lead to? It would lead to a better outcomes in care. Moving on to the next slide. Right. So we have respecting confidentiality and privacy, seeking feedback and clarification, cultural competence and sensitivity. Right. So now we have to discuss about the importance of respecting confidentiality and privacy, and seeking feedback and clarification, practicing cultural competence and sensitivity in health and social care communication. So why are these aspects very crucial in communicating with service user? If we talk about confidentiality and privacy, so confidentiality and privacy are essential to build trust with service user, and it ensures that their personal information is protected, encouraging them to share openly and honestly. So upholding confidentiality and privacy creates a safe environment for open communication, and now moving on to the seeking feedback and clarification, right? So if we talk about the seeking feedback and clarification, what it they do is it fosters a collaborative relationship between providers and service users, and right. So we're talking about, so we were seeking feedback and clarification, and we were discussing that uh, privacy creates a safe environment for open communication, Okay, we have discussed this and now taking feedback and clarification. Okay, so we have seeking feedback. Like it creates an environment, and that could lead us to more personalized and effective support for a service user by using the feedback tools. And now we have culture, competency, and sensitivity. So we should always look for the cultural competence and sensitivity, and we'll always use it. They have mentioned that when dealing with diverse service users, and it involves understanding and respecting their culture, norms, beliefs, and values to avoid misunderstanding and promote effective communication. So now moving on to the next slide. Okay, so in this slide, we have the conclusion. So in conclusion, effective communication is essential for meeting the diverse needs of service user in adult social care setting. And by recognizing its importance and implementing practical strategies, care providers can enhance the quality of care, promote service user empowerment, and foster positive relationships based on trust and mutual respect. Right. So now we move to the next slide. Right. Okay. So in that we have to assess the major requirements of record keeping and reporting in adult social care. So we have to discuss about legal and organizational obligation, legal framework, and organization policies and procedures. Okay, so on that. So now, for example, now we have to discuss about the legal framework, uh, and so legal framework that governs record keeping and reporting in adult social care. So, for example, if you talk about, as we are in the United Kingdom, so we will discuss about the United Kingdom. In the United Kingdom, we have the Health and Social Care Act, and we have the, uh, for example, we have the Care Act 2014, and we have the uh, we have other laws. For example, for record keeping, we'll use the Data Protection Act as well. So these are the important bits in uh, health and social care. So as they have mentioned about the Health and Social Care Act and the regulations in 2014, requirement record keeping and reporting in social care setting. So we have Data Protection Act as well. We have GDPR as well. So now if we adhere to these legal uh, regulation, and so what it does, it is essential for us to maintain accountability and uphold the quality of care. And next bit is organization policies and procedures, right? So organization responsibilities, why it is crucial for adult social care providers to establish internal policies and procedures regarding record keeping and reporting. So organizational policies ensures consistency and standardization in documentation process. They help ensure that all care intervention, incidents, and service user information are accurately recorded and reported. Aligning with the legal requirements, it is important for us. And consistent policies and procedures are vital for maintaining transparency and ensuring that all staff members are aligned in their documentation practices. So, for example, what information typically needs to be recorded in adult social care setting? So, examples could be, for example, um, service users assessment, care plans, medication administration record, incidents report, and any changes in the service user condition or preferences are commonly documented to ensure comprehensive and effective care delivery. So these uh, examples, like documenting these details, is crucial for tracking service user progress, ensuring safety, and providing person-centered care. Now we have to consider the importance of timely reporting. Right. So we have, okay. So for example, if we discuss about the timely reporting. So timely reporting enables swift intervention, prevents potential risk, and ensure that appropriate measures are taken promptly to address any issues or changes in the service user condition or care needs. So it is included in the organizational policies and procedures. Now we'll go to the next slide. So now we have to discuss about the types of records and reports. So in that one, we have to discuss things. So why, if we ask a question like, for example, if we have to examine care plans and why are comprehensive care plans essential in documenting service user needs, preferences, and goals? So comprehensive care plans ensure that care is individualized and tailored to each service user. They provide a roadmap for care delivery, assist in goal setting, and help track progress and changes in service user condition over time. So care plans are the documents that should be updated regularly to ensure they accurately reflect the service user evolving needs. And next we have is the medication administration record. Okay. So why are accurate medication administration record important? Uh, Accurate MAR records are essential for tracking medication usage, ensuring that right medication are given at the correct dosage and at times, and monitoring any observation or intervention related to medication administration. So, uh, medication administration record play a crucial role in improving and promoting the safe and effective medication management. So as a caregiver, we always use that. Then we have the incident report. Right. So what it does when we have to do some incident reporting, and it should be on time. So why it is helpful, and prompt documentation of incidents ensures transparency, accountability, and swift responses to safeguard concerns. And incident reports provide a detailed account of what occurred, actions taken, and any necessary follow-up measures. So incident reports play a vital role in ensuring that proper steps are taken to address and prevent future incidents. Now we have to move on to progress notes. Okay. So progress notes capture day-to-day observation and assessments and intervention, allowing care providers to track changes in their service user condition and evaluate the effectiveness of care plan and make informed decision for future care. So these all are the important points. Move on to the next slide. So this one is accuracy and completeness, time, liveness and confidentiality and data protection, communication and collaboration. Right. So we have to discuss about the key principles which are related to accuracy, timeliness, and confidentiality. So first we will discuss the importance of accuracy and completeness. Uh, and specifically it's for the records and reports. Okay. So why it is crucial for care providers to ensure that records are accurate, legible, and comprehensive. Accurate and comprehensive records are essential for maintaining the integrity of care information and ensuring that all details are clear and understandable. Standardized formats and terminology help in promoting consistency and improving the overall quality of documentation. So consistency in documentation is vital for effective communication and maintaining the quality of care. So now next we have is uh, principles of timeliness. Okay. So why it is important for care providers to ensure that the records are entered promptly and uh, reflect the documentation correctly. So timely documentation ensures that care activities and observations are accurately recorded and preventing delays that could compromise the reliability and quality of the information documented. And it also ensures that necessary actions are taken promptly based on up-to-date information. So recording information properly is key to ensure that accuracy and reliability of care records uh, are there. And now we'll move to the confidentiality and data protection. Right. So why it is crucial for care providers to adhere to strict confidentiality principles when handling service user information. Confidentiality safeguards service user privacy and build trust. Care providers must ensure that records are stored securely, access is restricted to authorized person only, and that data protection regulations such as GDPR uh, or the Data Protection Act are strictly followed to protect sensitive information. By protecting service user confidentiality, and it is like paramount in maintaining trust and upholding ethical standards in health and social care industry. Now we have to consider the communication and collaboration. Right. So uh, we have to discuss about the importance of communication and collaboration in record keeping, and how does effective communication among care team members and care team members enhance the documentation process and overall effectiveness? So effective communication and collaboration uh, ensure that every member of the team is like is able to uh, know about the service user, um, and they could all of us would have the important relevant information, and uh, the information is accurate and documented and shared among care team members, and it involves the interdisciplinary communication, and what it will help us to support a holistic care planning and coordination of services, leading to improved outcomes and quality of care. So this is important in health and social care. Now, moving on to the next slide. This is for the training and competence, training requirements and competence assessment. Right, okay. So, training requirements and competence assessment related to record keeping and reporting practices in adult social care. So, we'll discuss why it is important for care providers to receive training and education in recording and record keeping. So, because it is a part of our professional development, and training is very crucial. We discussed this earlier in our previous lectures as well. So, we'll discuss briefly about them as well. So, what training does? Training ensures that care providers understand legal requirements, documentation standards, and how to effectively use electronic record keeping systems. It helps in maintaining accuracy, consistency, and compliance with regulation. Proper training equips care provider with the knowledge and skills necessary for accurate and compliant record keeping. So we have to now talk about the competence assessment. So why it is essential to regularly assess care providers' competence in record keeping and reporting. It is important because regular competence assessment help ensures that care providers maintain proficiency in record keeping practices, and assessment can identify areas for improvement, provide feedback, and reinforce adherence to best practices to enhance the quality and reliability of recorded information. So regular assessments are crucial for continuous improvement and maintaining high standards of care documentation. So now we have to how can performance evaluation and audits assist in identifying areas for improvement in record keeping and reporting practices. So we have to discuss about for audit as well, right? Okay. So performance evaluation and uh, audits. Okay. So assessment. Right, okay. So we have to discuss about these. So audit can identify areas for improvement and reinforce adherence to best practice. Right. So now moving on to the next slide. So we have the conclusion here. So in conclusion, record keeping and reporting are essential components of safe, effective, and person-centered care in adult social care setting. By addressing legal obligation, maintaining accurate documentation, and fostering a culture of accountability and continuous improvement, care providers can uphold the highest standards of care delivery and ensure positive outcomes for service users. So this is in conclusion to what we have discussed so far. And now moving on to the next slide. Oh, it's time is over. So I'm again sorry because I'm taking a lot of time. So because I thought that these all are the important aspects, so we should discuss each and everything. I'm sorry for taking a lot of time. So now moving on to the next one is we have to evaluate the application of best interest in cases where service users are unable to consent. Right. Okay. So this is again really important in health and social care. So we will explore the crucial concept of best interest. Uh, right. So we in evaluating the application of best interest, it involves a deep dive into ethical, legal, and practical consideration. And why determining and acting in the best interest of a service user is essential when they lack the capacity to make decision for themselves, um, because determining and acting in the best interest of a service user ensures that their welfare and rights are protected when they are unable to make decisions due to incapacity, and it upholds their dignity and promotes their well-being. Upholding the best interest of service user is a cornerstone of ethical care practices, and now we have to consider some ethical consideration when applying the best interest and standard in adult social care. So, how might ethical principles guide decision making in these situations? Ethical principles such as autonomy and beneficence, known maleficence, and justice help care providers navigate complex decisions by considering the service user preferences, doing good, advocating harm, and ensuring fairness in the decision making process. Ethical principles provide a framework for balancing the various factors involved in the determining best interest. Now we have to discuss about the legal aspects. Right. So for that, because um, it involves some legal aspects as well. So in that we can say that uh, in that we have the important act like, for example, mental capacity act. Mental capacity act is really important uh, in advocating a service user. So what Mental Capacity Act in the United Kingdom does, it outlines the process for determining best interest and highlighting the importance of consulting with relevant parties, considering the service user past and present and wishes, and acting in their overall well-being. Legal frameworks provide guidance and safeguards for ensuring that decisions made in the best interest of the service user are lawful and protect their rights. And lastly, we have practical consideration to consider. So there are some factors such as the service user care needs and available resources impact the determination of their best interest. Practical consideration involves assessing the service user immediate and long-term care needs, the resources available for their cares and the feasibility of different care options, and balancing these factors is necessary to ensure that decisions made align with the service user best interest effectively. So balancing the ethical, legal, and practical consideration is essential in evaluating and applying the best interest, and um, these are the standards in adult social care. And this is all about, I believe, for the best interest. Any questions, please ask. And let's move to the next slide. Right, so we have to discuss about the ethical considerations. Okay, so um, we have to discuss about the autonomy and respect for person beneficiaries and non-beneficiaries. Right, so in the context of best interest and decision for individual lacking capacity in adult social care, we need to discuss about these important points: autonomy and respect for person beneficiaries and non-beneficiaries. Right. So if we say that why it is important to consider values and preferences of individual even when making decision on their behalf, so respecting a person's values and preferences, even in their absence, upholds their dignity and autonomy. And decisions made should reflect what the person would likely choose if they were able to express their wishes. If they have the capacity, what could they would wish for, and what could they have selected um, as their care. So respecting a person's autonomy involves honoring their individuality and ensuring that decisions made align with their likely wishes. And if we discuss about now the um, considering beneficence and non-maleficence, so why it is crucial for caregivers to prioritize the well-being of service user and prevent harm when making best interest decisions. Prioritizing beneficence ensures that decisions aim to promote the service user well-being, while non-maleficence emphasizes preventing harm. Care providers must carefully assess the potential benefits and risk of intervention to ensure they maximize benefits while minimizing harm. So, striking a balance between promoting well-being and minimizing harm is essential in ethical decision making for individuals lacking capacity. So now we have to uh, discuss about the practical application. So, for example, uh, how autonomy and beneficence might guide a best interest decision in adult social care. So, just for example, if a service user with dementia had previously expressed a strong preference for home care over a residential facility, so decisions made in their best interest should prioritize maintaining their autonomy by exploring home care options. And what it will does, it will promote their well-being and dignity. So when we make decisions, so centering decision on the service users' known preferences demonstrate a commitment to promoting their autonomy and well-being. So we have to discuss about the how might the principles of known maleficence guide decision making in cases where there are potential risks involved. So when considering a medical procedure with certain risks, the principles of known maleficence would require assessing whether the potential benefits of the procedure outweigh the risk to the service user, and decisions should be made with a focus on preventing harm and ensuring the service user overall well-being. So when we do that, so careful evaluation of risk and benefits is crucial in upholding the ethical principles of known maleficence, and understanding and applying these ethical principles in the best interest decision making are essential for ensuring that individuals who are lacking capacity in adult social care receive appropriate care. This is important. So now moving on to the next slide. Oh, A lot of time of yours today, so sorry for that again. And now in the next slide, we have to discuss about the legal consideration, right? So we have discussed about the mental capacity legislation. So we discussed previously about the Mental Capacity Act, and then we have to discuss about the court decision and right. So the first one is the Mental Capacity Act. So that is a legislation in the United Kingdom. So we always use the Mental Capacity Act 2005. And so according to this legislation, decision made on behalf of individual lacking capacity must be made in their best interest. And we discussed about it earlier. And like we have to um, take into account their past, present wishes and beliefs, values, and any other factors which are relevant. So, for example, we will take into consideration their religion, culture, age, gender, their individual identity. So now, for example, dealing with the court decision. So right. In cases where there is uncertainty and or disagreement regarding what is the service user best interest, so court may become involved to provide guidance or make decision on behalf of the individual. So sometimes we have those court proceedings and then we need to um, again work for the best interest of the service user. So everything is based on the best interest of the service user. Moving on to the next slide. Right. So we need to discuss about the practical considerations regarding the multidisciplinary approach and documentation and record keeping. So in health and social care, multidisciplinary approach is really important. We have discussed it a lot of time, and especially in evaluating the best interests of a service user, multidisciplinary team approach is very important. Just for example, they have given us the example that including social workers, healthcare providers, family members, and other relevant stakeholders. If the service user lacks the capacity, then we may involve these professionals or social workers, healthcare providers, or family members, and maybe other relevant stakeholders. And if the person has the capacity, then we will also discuss these options with the family as well. In my practical experiences, uh, we always contacted the family members and we made the care plan according to the uh, input or the wishes of the service user. So it is important to always look for the multidisciplinary approach. And now we have to discuss about the documentation and record keeping. So we discuss about that documentation and record keeping is important. We need to follow the GDPR guidelines. We need to follow the Data Protection Act. And when we are making some decisions about the best interest, so they should be transparent and we should be accountable for it. And it involves that decision making process and the reasoning behind the final decision should be included in the documentation and record keeping. So now we have the next slide. This is related with the evaluation. Okay. So the evaluation of the application of best interest required a holistic assessment of the decision-making process, considering both the outcome achieved and the method used to reach those outcomes. So we have to always look for the important points. These bullet points are very important, that we need to consider that decisions were made in accordance with legal and ethical principles. we always uh, we always as a healthcare provider we always have to look for the legal and ethical side of the decision, so it should be made accordance with the legal and ethical principles. Then service user wishes, values, preferences were appropriately considered. So we have to always look for uh, the service user wishes, values, and preferences. It should be according to the best interest of the service user. Again, if the service user lacks capacity, then we will use different approaches which could lead for a better best approach or best interest for the service user. If the service user is having the ability to make decision on their own behalf, then it should again related with their wishes, values, and preferences. So we have to look for the risk and benefits carefully, and there could be some risk. For example, if I think that uh, something is good for a service user on my own, and maybe there could be some risk involved, and if I'm properly trained and if I will work with the multidisciplinary team approach, we all work together for the betterment of the service user, then that could uh, give us some benefits, and the risk could be lessened and there would be more benefits. Then the decision making process. So decision making process should always be transparent, and it should be inclusive and well documented. So we should not like miss any um, important points in documenting a, um, a decision making process, and it should be made in a timely manner. This is all about the evaluation. So now we have about discuss about the conclusion. So okay, so we discussed about the effectiveness of applying best interest in cases where service users are unable to consent. Depends on the extent to which decisions are made with careful consideration of the service user individual circumstances, needs, and rights. So while adhering to the legal and ethical standards. So we discuss everything about it, and there's important bit is continuous reflection, evaluation, and improvement of decision-making process are essential to ensure best interest decision genuinely serves the welfare and dignity of the service of the individual they are intended to protect. So, okay. So in health and social care, we have the duty to follow all the legal and ethical aspects, and we should always look for the best interest of the service user, and we always need to reflect, and we always need to do the reflection of our own self as well for to make us a better service provider, and we need to evaluate and we need to make improvements of decision making processes are essential, and that could relate to the best interest of the service user. So these all are the important points related with this learning outcome one. What we have next is okay. Now we have the references here. Okay, so I will now. Any question up till now? I'm sorry I took a lot of time today, so I took about half an hour extra of yours. Any question?
No.
No. Okay, that's fine.
All right.
So we will finish today's lecture then, and we will discuss the learning outcome 2 tomorrow. So I'll see you all tomorrow. Thank you. Take care, everyone. Bye. I'll stop the recording.